Hey YouTube, it's me, Nurse Leslie, the beauty on duty. Today I'm coming to you with a new what's in the bag. So those of you that have seen my previous videos know that this is my second semester in nursing school and our focus is medical surgical nursing. And I went ahead and invested in a few different resources that I feel like will help me in my studies as well as my practice. So I thought I should share it with you. The first thing is the Derm Notes Clinical Dermatology Pocket Guide. And I actually got this for Christmas from my mom, and it's really awesome. Those of you that know about me know that I am a licensed esthetician, also called a skincare specialist. So dermatology, skincare, that whole arena is my area of expertise. With this nursing career, I plan to work in a cosmetic dermatology practice or medical spa as a nurse, specializing in dermatology. So, you know, in my practice as an esthetician, I haven't seen very many out of the ordinary skin conditions, but obviously there's a whole little book full of things and a whole specialty designated for skin, hair, and nail conditions. So there's a lot that I don't know. And this book is really awesome because every time I open it, I learn something new. Things like, cutaneous horn. Yeah, I've never seen that before, but now that I have this book, I'm learning about a lot of new things. So if you're interested in dermatology and recognizing different skin conditions, definitely check this one out. And it fits in your pocket. How awesome is that? The next little pocket guide, and as you can see, I'm like addicted to these little miniature books. They're so handy. They have so much information and they literally fit in your pocket. Yeah, and you'll see, if you're not in clinicals yet, you will see that you try to fit as much as you can into your scrub pockets. And these are really handy because they're pretty small. So this one is the Med Notes Pocket Drug Guide. And this is the drug guide that I typically use. And I've had this probably since the beginning of my first semester. And as you can see, it's a pretty thick book. It has a lot more information than this one does, but this one actually fits in your pocket. It has some of the more common drugs and not necessarily every drug that, you know, has ever been created. And it has the same information, whether it's a scheduled drug, whether it's should be used with caution in pregnant patients, the indications, therapeutic effect, the dosage, administration, adverse reactions and side effects, and contraindications. So it has all the same information. It's a really great book. It has some different tools that you can use in your practice. So I really like this. And actually, this past clinical, I did carry it in my pocket. So it is very useful. Definitely not something that is going to sit on your shelf and collect dust. My next clinical pocket guide is the Med Surg Notes, and I've had this since the first semester. Kind of towards the end, I purchased this one, and it's actually really awesome. It has a section for each body system, and it shows you how to do a rapid assessment of each system. For instance, the rapid neurological assessment. You want to assess the level of consciousness and responsiveness. And then it has different things like levels of consciousness, whether they're lethargic, obtuned, stuporous, comatose, different things like that. And then it has different diagnoses like, let's see, change in mental status or delirium. The clinical picture is that the patient may be or have confusion, restlessness, agitation, and so on. So it gives you a lot of different things to look at. Your immediate interventions would be provide supplemental O2 if saturation in room air is 93% or less. Check MAR for recently given medications. So it gives you a lot of different things that you should do. And it's very handy if you're going to be doing medical, surgical. I definitely highly recommend this one. Let's see, the focused assessment, stabilizing and monitoring, and be prepared to ... So there's a lot of different things in this book. Like I said, it goes over every different system from musculoskeletal to endocrine, GI, everything. I love this book. The next thing, I actually got this for Christmas also from one of my teachers. We had a little Christmas party and we exchanged gifts. And this one, oh my gosh, I wish I had this in the beginning. I literally just got this about a month ago or less. And it's a really cool book. It not only has a calendar, a weekly calendar as well as a monthly calendar, but it has little resources like, let's see, characteristics of commonly used intravenous fluids. So it's really good as a study tool also. I really like that book. We were required to purchase the HESI examination resource. We haven't done anything with it yet, but I'm really excited to see if it helps me with my studying. So this is the little, let's see, case studies with practice tests. I love case studies, so anything that's going to help me to practice my skills before you go into clinical and have to practice them on a patient, at least you know what to do before you get there. We are currently taking pharmacology. So this is my pharmacology textbook, and it's really great. It is by Lippincott, or Walters, Kluwer, Lippincott, Williams, and Wilkins. And most of our nursing resources are made by this company. And this is a really comprehensive, easy to understand book, so I really like this. It comes with a workbook as well as, this is called the Photo Atlas of Medication Administration. So it has like pictures of what to do when you're giving medication. This is an insulin demonstration, mixing medications from 2 vials to 1 syringe. Yeah, it has a lot of different things, and these are really awesome resources, which I really, really love. I recently invested in, this actually goes with the Davis's Drug Guide for Nurses. This is their med deck, and it comes with these note cards, already pre-written, so I don't have to write them all down myself. And it's a pretty thick packet, but I really like it because it's helping me with pharmacology. So let's see, oh, I actually have some homemade note cards, which I really, really use a lot. Like, for instance, I made a little deck for emergency medications like vasopressin, solumedrol, Lasix, the ones that you would normally give in an emergency. So I study these, I study what their action is, how much to give, because you don't want to be stuck in an emergency situation and not know what to do. So it's better to have a heads up by studying it in advance. Also, my pharmacology book comes with a little CD-ROM with activities on it, really awesome. And my nurse's drug guide also comes with a CD-ROM, really awesome. When I'm making my note cards, I use my highlighters. You guys know how much I love to color, making my note cards nice and pretty. So I have a new pack. I used to have a 5-pack, now I have an 8-pack, and they have really pretty pinks and purples and blues. I love it. So we're actually this semester in a hospital instead of long-term care, skilled nursing facility, and we had to go get new IDs, so we look really official. And on our ID, it actually has a few different little resources like basic hospital security, what to do in an emergency, reporting suspicious activity, calling for assistance, hazard communication program, and stroke signs. So, in the case of an emergency, any type of emergency like a fire or somebody maybe having a stroke, we have these resources right around our neck. I also keep some little sticky notes so that if I have to write a note, I have paper here, very handy. My name tag is magnetic, so I keep it right here just in case if I'm, so I don't lose it, I have my pen light and an ink pen. So I keep this, right around my neck except for my name badge, which I will put on my uniform. So these are all my new little goodies from this semester. You know, your school may have a specific, you know, textbook, which is fine. I'm just sharing with you what we're using. But by all means, you can go out and purchase the Nurse's Med Deck, any of these clinical pocket guides, and the HESI, which is supposed to help with NCLEX. So I hope you enjoyed this video. If you have any questions or comments, I'd be happy to hear. Don't forget to rate, subscribe, and leave comments. And I'll see you on the next video, guys. Bye-bye.